usually are in contact mainly with the staff, but they tell us when there is a language barrier, sometimes you're not able to say all the words you would like to say, or even say hello and welcome and please take a seat. So what we hear is that they feel that they're being able to do their work in a more polite way or a nicer way, no matter what the language is. And there are very nice stories about people giving them hugs because they're so happy to be able to hear their own language and understand. And I think that's we are the happiest when we hear those stories.
Welcome back to the Designer Will See You Now podcast, where we talk health, design, and advocacy. And today we are talking with Maja Magnusson, who is CEO of Care to Translate, a medical translation tool that helps break down language barriers between patients and care providers. A growing shortage of interpreters around the world can lead to long waiting times and loss of agency for patients and stressful work environments with a higher risk of misdiagnosis and malpractice. Care to Translate aims to address this issue in order to make healthcare more dependable and accessible for everyone. Maja joined as a co-founder in 2018, the same year as the official first launch, and stepped up as CEO in 2023. Since then, she has helped to grow the company and shape innovative new features like Live Translate, which we'll get into, resulting in a recent Red Dot Award for design. Today, we'll be talking to Maja about why culturally sensitive medical translation is critical for staff and patients, the risks of relying on machine translation, designing for emergency scenarios and accessibility, and what it's like running a startup. So welcome, Maja. Thank you so much for being on.
Thank you. You're welcome.
And just to get started, I know that you have a little demo you're going to run us through for Care to Translate, but in your words, would you like to describe Care to Translate and how it helps patients and care providers?
Yeah, I mean, it's quite basic. It's a digital translation app. It's a service that can be used anytime you need it, but helps you to translate with more accuracy and also protect the patient data, which is really essential in healthcare. So giving you a interpreter translator whenever you need it, with good translation quality, to make it easier to understand, to make the patient journey more safe, but also to be able to save loads of time and costs as well for healthcare providers.
Nice. And we can go through a little demo just so our listeners can get a sense of
All
what
right.
the tool looks
So
like.
I'm gonna try to share my screen. And so yeah, here is the app. Just some information before I get started with the demo. You usually create an account for a department. This means that the communication is more coherent with the patient flow as well. So this could be a account for an emergency department where you have different types of playlists. A playlist is a list with predefined phrases. And in healthcare, you work a lot with routine communication, which means you usually ask the same questions, give the same information and instructions. And these playlists give you the opportunity to provide those phrases as a pre-designed list, which saves even more time for healthcare providers. So let's say that you need to inform the patient before a surgery about certain things. You can have this list. You click through the phrases, and in this case, I've selected the language German to translate to. So we have a German patient. And for example, you want to say that we will make markings on your skin, which is maybe something people are not used to if they haven't been in surgery. So you'd simply press on the phrase.
Wir werden Markierungen auf Ihrer Haut machen.
And it will read out the translation in sound, but also show the text. And in this case, there is also image support, which will help you inform the patient what is going to happen. So these lists are actually the feature that is used the most in our product. You can search for phrases as well. So let's say you're looking for a certain word or phrase, you can search for it, and the results are actually pre-translated and validated phrases, which means that the translation quality is really high. But of course, there are many situations where you want to communicate more freely. And in this case, you would select the live translation feature, which is a voice-to-voice, real-time translation feature, and simply speak into the app or type if you would like to. Are you in pain?
Haben Sie Schmerzen?
And as you can see, the app can also access our phrase library in real time, which means that even I speak in real time, the translation has been already verified, and I, as a user, can use a human validated translation in real time, which brings me the human interpreter basically into the digital conversation. And then the patient can answer, for example, ja, ich habe sehr starke Schmerzen.
Yes, I am in very severe pain.
And if I feel uncertain, let's say I'm a patient, I feel uncertain that the translation was correct, I can use the back translation button, which will instantly give me a back translation and show me that my input and the reverse translation are very similar or the same. And that can give me some confidence that the app says what I wanted to say. So this is basically how you use the app. There is also one feature to add interpreters, which are human interpretation services to the app. And here you can connect services that you're already using at your hospital and, for example, link emergency interpretation services to the app. This means that you can access them through the app, call them directly through the app, so you don't need to have separate apps or booking systems. You can have everything in the Care to Translate app. But our product and what we're building is the live translation feature in combination with the phrase library that consists of many thousand phrases, and you can get some inspiration by discovering the content. There are many ready-made templates for you. So let's say you work as a dentist, you could access the dentistry phrases and have ready-made lists for you, which can help you a lot in your routine care as well. So that was a bit about the Care to Translate app.
Wow, amazing. I was super excited to just kind of play around with it and see for myself, just yeah, I don't know. The demo made me want to play with it. I don't know how it made you feel, but that was really cool. Thank you for sharing that.
Yeah.
I also love the subtle trilingual flex in there. That was cool. I didn't know you spoke
When
German.
you pulled the German out, I was like, wow.
Yeah, I was like,
okay.
oh, okay, all right, here we go. Oh, that was really cool. And now you've shown us some of the different contexts, right? And you mentioned even patients who aren't used to going into surgery, and I wanted to know, are there any specific use cases besides that example where you've seen maybe the most notable impact or response from patients or clinician users?
I think especially in unplanned cases, emergency care, everything from ambulance services, emergency clinics, birth clinics, everything that is not really planned, here is a really good use case because the system today relies on human interpreters, and to make that system work efficiently, you use them when you have a planned appointment or planned doctor's visit. So for all the unplanned situations, it can be really hard to get a hold of interpreters, which many people don't really think about. Is interpreters have also normal working hours. So especially nights and weekends can be really hard to get a hold of a person, instantly. So this is a really good use case. But also what we've seen is giving care to patients that need to stay for a longer period of time, let's say several hours, several days. They are typically really isolated in the hospitals because, again, you don't have the interpreter by your side 24/7. Usually you get the interpreter when you're admitted or discharged from the hospital, and maybe if you have a really important conversation with a doctor. But otherwise, you will be at the hospital without any communication help. And the staff, even though they want to treat everyone equally, they can't. And simple questions such as, would you like something to eat, or do you need to go to the bathroom, can be really hard. So that's actually a second really big use case that just has emerged, and where we can see that the use of the app is really good as well. And pediatric care, I mean, any care can really benefit of the app, but let's say speaking to children and often their parents is also a quite hard setting. Sometimes the children speak the language better than the parents, but the parents still need to be present. So here is also a really good use case, for example.
Yeah, that's beautiful. That's such a typical like immigrant story too, that the second generation will speak the language of the country that they're in, but the parents also need to know that, or the other way around. If like I've heard of children in the US, for example, needing to translate the care for their parents, and then having to do that as a kid, that's a lot of pressure on someone who's so young. So that's really cool. Can you walk us through a little bit more about the difference between the experiences for the staff and the recipient of the care?
Yeah, I think we have focused a lot on the staff because we want to give the staff a tool. I mean, we could equally focus on the patient, but our focus has been from the staff perspective. And that's probably because 3 of the co-founders are doctors, and they really needed a tool themselves to communicate in healthcare. So that has been our main perspective when designing the app. But of course, the care recipient or patient perspective matters a lot. And what we take into consideration is how well can the person communicate healthcare related topics. So we designed the app to make the content really easy to understand for any type of recipient. So let's say it's a child, they should understand what you're saying, or it's a person who maybe has not a high education and doesn't understand complex words, for example. They should still understand, or it's an older person. So that plays a really big role. And cognitive abilities, for example, do you hear well, or can you read well? So that is something we take into consideration. So the wording itself and the text, and of course how it looks in the app, is important, but the sound plays a crucial role because it's not given that all these patients that you meet can actually read. A big share, and people are often surprised, but a big share of the patients in the biggest need of using these types of services can often not read very well. So just providing them with information in written text is often not sufficient. So of course, we consider them, and the output should be something that is easy and good to understand. But when it comes to designing the application and navigation, the UX and the UI, we think a lot about the staff.
Mm-hmm. Yeah, that makes sense. Yeah, and like you said, medical jargon can be its own language to begin with, even. So just translating that into regular English or Swedish is something in and of itself. And we're also curious too, because we've had this conversation about, since we're both designers as well, the finding a good word for users or patients, and you've put it as care recipients. Can you tell us a bit about how you kind of landed on that?
I would say that's a bit of a work in progress. And it started off in a hospital. So it was really easy in the beginning. It was healthcare staff and patient. But as we have been growing, we have found new customers and new use cases. So right now we are experiencing a really great interest from elderly care and social care services as well. And they, of course, didn't really find themselves in our patient healthcare provider communication at first. So we tried to adopt a bit broader, and that's why we, for now, have landed on care recipient, because it's someone that can be a patient, it can be someone that needs assistant. But yeah, it's still a work in progress, and it's not so easy because we want the user to really feel that the application speaks to them. How do you do that? It's easier when it's very niched. It's harder when it broadens, and that's what we're experiencing at the moment.
No, I really like the term. I remember we were both talking about it, me and Ola, and it's hard to even also just find a word that is descriptive but also like humanizes someone who's using your digital tool or your product or whatever it is.
Yeah.
Because user is so yeah, has a certain
And
ring.
even patient, I mean, it's obviously the most commonly used in the medical field, but it still kind of reaffirms, we've had this conversation with Bella, it reaffirms this idea of that person being sick. And so it's
Exactly.
like, you know, how do you walk that line? And I noticed you brought up a lot of kind of vulnerable populations that you design for, with the elderly, with people in need of social care, and also migrant populations. And I wanted to touch on kind of your origin story with Care to Translate, with the founder Linus Kolenge. So tell me if I'm saying that right. And you mentioned on the website that the original thinking behind the idea was came from his placement in a medical center which had a high migrant population, and his shock at the level of language confusion in that population between the staff and the patients, or the care recipients. And I was curious, what have your experiences been kind of testing and using the app now in those same sorts of scenarios, now that you're addressing the issue that Linus originally noticed?
I mean, those places are, of course, the best for our product because it can be used every day. And what we hear we usually are in contact mainly with the staff and our users and customers, but they tell us also about the encounters becoming better because they themselves, they always want to do their best and want to treat everybody in the best way possible. But when there is a language barrier, sometimes you're not able to say all the words you would like to say, or even say hello and welcome and please take a seat. So what we hear is that they feel that they're being able to do their work in a more polite way or a nicer way, no matter what the language is. And the response of the people they meet is usually really positive, and there are very nice stories about people giving them hugs because they're so happy to be able to hear their own language and understand. And I think that's that, I mean, we are the happiest when we hear those stories, and it kind of just is a testament to we're doing the right thing and we're on the right path. And of course, in those communities or in these places, that happens more often. Then again, we have healthcare providers that might have maybe a patient once a week or so that needs help, but still for them, it's a good solution and can help them provide the same service, even if it's not as often as the other ones. So we try to understand when it comes to usage and volume of usage, if the customer is happy and if it's like a good fit for the customer. But we have really come to the conclusion that we cannot really base that just on the number of usage, because for someone using it once a week, it still might be a really good tool compared to someone using it every day, several times a day. So if it helps and if they feel like it also saves time for the staff, and you mentioned patients bringing their children or relatives to the appointment, if you can save their time as well. Or a lot of staff members tell us that they use staff members that speak different languages, but that also means that when the patient comes in, they need to go and fetch that staff member. That will take their time again. So time is saved on both ends. And I guess depending on where the caregiver feels it's beneficial, then it's already a win for them.
Mm-hmm. And I'm sure it's so validating and touching for the care providers as well to have those interactions where they can see that the patient feels heard, and you're setting kind of that foundation of trust also.
Yeah.
So I'm sure that they're so grateful to have that means of facilitating the communication and, like you said, like offering care in a more polite way. And it resonates with me with Bella, what you were saying about, first generation, second generation immigrants and that feeling of loneliness and not feeling, 100% part of the community, and having those moments can really help address that. So it's amazing.
And there is, there's so much data on this topic, and I could speak for several days about this. But I think one of important factor we should also keep in mind is that these populations usually seek care more late than early because of the language barrier. So they feel they maybe cannot communicate as well or are not being understood when they go to the doctor. So they usually wait, sometimes too long. And so once they get to the doctor, they're usually sicker. So I think there is a great benefit of also addressing this and getting the information out that we will understand you and we have the right tools to give you care even if you're not super sick yet. So I think that's also something we should consider when talking about this solution. It's not only when they come, it's also what happens before or after.
Yeah, I think that's a really important thing that you're bringing up too about, and it's more than just, it's not just like just going to the doctor, just booking an appointment. There's like so much baggage people are bringing in with them, and all that baggage looks different depending on your background, and just that feeling of not feeling seen or heard at something that's really important for your health, that's got to be really, also really isolating. So no, that's really, I'm really impressed by that there's a lot of thought around those topics as well, and especially in Sweden, where also I don't know if we mentioned in the beginning, but that's where you're based as well. That I think we have this thing where we don't really like to talk about the systemic discrimination or about topics like diversity, equality, inclusion, and we don't really feel like it's necessary, or like we have this idea that we're this kind of utopia sometimes with that, oh, we don't need that because that doesn't happen here, and that it's an uncomfortable topic for a lot of people, and I'm wondering if you've found ways to talk to stakeholders, or even, I don't know, politicians, things like people who make the decisions about things like this. Have you found a way to talk to stakeholders about it in a meaningful way?
I think this is a really good question. And I maybe have two answers. The one answer is that Care to Translate and we work here, we are really, our vision is that everyone should be able to access care no matter the language they speak, and should be able to communicate with care providers. And we are against inequalities and all of that. But when you talk to stakeholders, these topics are topics that most people are engaging in and also like to talk about. But it maybe does not result in any action always. So the other perspective, which is maybe not so heart-filled, but where they actually listen, or where they start the conversations with us, is that language barriers result in really a lot of inefficiencies and costs for society. There are costs for interpretation services, for example, which are quite high. There is the cost of seeking care too late, for example. There are studies that have been made that patients who don't speak the same language as the care provider usually stay 2 to 4 days longer at the hospital, because you need to make sure they're okay. You maybe do more examinations and samples with these patients because communication is not given. So you have to have other tools to make sure that the person is getting better, for example. So all of this results in a lot of time loss and cost, inefficiencies. So that is something we can address. And I'm really happy that we have a solution that can save time and save costs, but can also enhance the other parts, which, our heart burns for, such as making sure inequalities are a bit less, hopefully soon. Make sure that patient safety is higher. Make sure that the work environment is a bit nicer, because you don't have to run around try to solve the language barrier. You can solve it with a tool, and then you can get on with what you actually want to do, help the patient. So I think there are two sides of it. There's the side of people liking the topic and liking to talk about it, but the action comes mainly from the parts where you can actually save costs, when it's on like an organization or even like a regional societal level.
Yeah, definitely. I can recognize that also with health tech solutions too, that the KPIs are, like you mentioned earlier, they're completely different from time spent in the app or things like that. And it is about saving time and cost. And it is hard to measure that those feelings of feeling seen or heard, but you can measure time saved, and that people actually get to help patients further, and
Exactly.
and also getting people to come in earlier. And just to touch on that really quick is, how do you what does it look like when the patient, because or do they need to also download the app? No, they don't. Okay.
They don't. They can. There is a smaller version, you could say, of the app, where those phrases that I showed you is from a patient perspective. So you, as a patient, you can tell about your needs or your symptoms, or if there is any medical history that is important to share. But again, the tool has been designed initially for the healthcare provider. And the reason is mainly because the healthcare staff, they work with the sick patients or the care recipients every day. The patient on the other side might not be going to the doctor, the healthcare provider, more than maybe once a year. So the tool and the usage of the tool is higher for, the ones actually working in the sector. But there is a solution, and it's been downloaded and shared. It's free, so people can just download it and start using it. As a patient, you don't even have to set up an account. And again, that's a bit connected, of course, to our vision of being able to communicate no matter the language in this sector, which speaks to both sides, of course.
I think that's really thoughtful also in terms of just in an emergency situation also, especially where you're like, okay, let's start by downloading this app so we can even talk to each other. That makes a lot of sense. You pointed out earlier the use of some AI, and AI models they do lean towards Western values more and are generally built by and for that population. Do you have any examples of some cultural sensitive translations that you've noticed that need to be communicated in a different way?
Yeah, there are lots of them in my language team, because we have a team of linguists that they only work with these things. They could tell you even more, but some words that we use in Western world or in Sweden even, they don't exist in some of these languages. So there is no translation possible, but you can always describe it. So we work a lot with trying to provide a communication that will make it still, understood, even though you will describe. An example is a word like menstruation, which is a very known and a common word for us, but in some cultures and languages, that word does not exist. So you have to kind of describe it in a different way. And yes, it's of course also connected to how do you communicate about different topics such as mental health. It's in some cultures, it's maybe more taboo to talk about these things, and so we always, when we work around the phrase library, which is you could say the holy grail of our product, is where all the phrases live. We make sure that all the translations can be connected to each other. So no matter if you select Swedish to English or Swedish to Somali, it should always, be the same translation. And here we work with guidelines around making it, of course, a good translation when it comes to the medical terms, but then also the contextual term or translation. Some words in some languages can have many different meanings depending on in what context you use it. So that is something we look at. And then as a third step is the cultural translation, to make sure that you're actually saying the same thing in both languages, but it might not be a word-to-word translation, might be described in a different way. So we can provide that in the product. And if you communicate topics that are covered by our phrase library, even in real time, you can make use of those validated translations. And then, of course, there will be some communications that are maybe not covered by us yet. And herefore, we have built in some security measurements, such as the back translation. There is also a feature, I didn't show it before, but you can, as a customer, you can set a accuracy score, which is calculated, and then you can display certain information to the user that the accuracy is too low based on the rules that the organization has set. So we try to make as much as we can to guide the user to use it in the best way possible, to make sure that the translations are the best. But of course, there is a lot of communication that can happen. We say this. We three could say the same thing in three different ways. Sometimes it can be hard to cover all scenarios, but we're getting there step by step, I would say.
Yeah, it's really interesting to see how you've approached translation, both with the phrase library and the live translation. And to your point, the verification of kind of the cultural nuances, I think I understand is the key differentiator from just using a regular translation app. Obviously, you need the medical verification too, but I can imagine that there are a lot of nuances there that you just can't pick up with just any old translation tool. And just for our listeners, for anyone who's not familiar with machine translation tools, they do use systems that are trained on language data sets. So examples of natural language, and then they use that in order to identify patterns and begin to interpret the new language that they're processing. So I wanted to dive a little bit deeper into Live Translate and understand, what data set is it trained on, and as far as the verification against your phrase library, I thought that was really interesting, and I was curious how close to the phrase does it need to be for it to kind of pick up that it's the same?
Yeah. Really good questions again. So I think the foundation of our product is a modular one. So we can use generic models that are on the market, which allows us to pick the best one that we see is the best one, or we could pick several ones depending on the language pair. So we screen the market to see what models are available, what have the best results in the sector already. And then we can add a customized data training based on our phrase library. And the phrase library has been built over actually 10 years. So it started even before the app was launched. And it's just a big data set of words and phrases that are communicated in healthcare and care in general. And we can then make sure that the languages can be trained on these data sets if we want to. And then the next thing is that we can add the match. We can add the match in different ways. So we can have a one-to-one match, which is maybe the easiest one. But then we can also make sure that if you are maybe typing something that is quite similar to something that we have, that we can show that result as well. And here, I think there are many more opportunities for us to even polish the product even more and make use of AI in general, but trying to filter it back to validated content that we can show. So it's a combination of many different products and tools, our data set, and human validation. But I would also like to highlight that the phrases themselves, they're not just any phrases. They are worked on quite intensively to make sure that they are easy to understand for the recipients. So the formulation in themselves will enable a higher quality of translation because they have been formed in a way, could say they're kind of like prompts to make you translate better. So just using them on machine translation will bring a better result. I'm most definitely positive about that. So there are many different combinations that can be done with the AI and machine translation products in combination with what we have in our product. And I mean, the large language models are developing quite fast in a rapid pace. So we're really scanning the market all the time, trying to understand what of the new developments could we use to enhance usability even more or make sure that translation quality is even better. Because, I mean, the greatest goal would be to be able to actually provide a real-time translation feature that is 100% accurate every time. But working in the sector and actually, doing a lot of translations for the data set shows us that even though a lot of others might think that the quality and accuracy is like here already, it is unfortunately not. So we do a lot of post editing and customizations to all translations that are processed. Some languages less, and some languages more. And yeah, English, of course, is one of the languages that perform the best. But then there are languages where there is not enough data yet trained for these models, which does not only allow for lower accuracy when it's translated, but what you mentioned before, making the Western perspective shine through. That is also one of the things happening today, of course.
Mm-hmm. Yeah, I love that you bring that up because it makes me think of this article that you had on your website, which I thought was really interesting, with Lynn Bowker, this machine translation literacy expert, and she brings up that exact point about the accuracy and people's misconceptions about the capabilities of live translation. And as you said, these language models are constantly developing, and so the accuracy will continue to get better. And I love that you guys have also built basically your own library too, that is the gold standard, that you can work off of, that kind of differentiates you from other translation tools as well. But she has this one quote where she says, the problem for users is that it can be quite unpredictable. Just because you had great results the last time you used the machine translation tool, there's no guarantee that next time will be a success. So you brought up all the different approaches that you have to kind of mitigate that risk, but I'm curious, are there use cases in which you see the risk is too high to use a tool like that, or anything that you would want people to keep in mind when
Yeah.
using these tools?
I think there's several use cases where you really have to make sure that the information is being understood correctly, and that is also in situations when there's no translation happening, but we would communicate this way, and you want to make sure the other person understands. Could be topics like abortion, for example, and consent to abortion. And what we're trying to, or how we're trying to help the user, is by identifying these more high risk informations in our application. So when you speak about, for example, abortion, or if you speak about allergies, things like that, to highlight that to the user, that you're speaking about a topic that is quite sensitive, and you should really make sure that the person understands your questions correctly. And we have some ways to, ask, did you understand the question, and follow up on that, but also to inform the user that you might want to consider to use a human interpreter at a certain stage. So that's how we try to guide the user. And go back to Lynn, who is really an expert within this area, I think a lot of it comes down also to people not being experts in using a machine translation or AI translation tools. It's being used as if it's a calculator, and you just enter anything and then the answer will be there for you to use. But there are so many ways to communicate and to formulate yourself, and there's some ways that are better for these tools and will give you better results, and some ways will probably give you worse results. And so one aspect of our product development is also to build in machine translation literacy into the product, to kind of level up the standard of knowledge how to use these tools, no matter if it's our tool or any other, like a free open tool. There are ways to make the translation better. And But if you think about the user is not a machine translation or large language model expert who has been working with this for many years, or a linguist who knows about all these things. It's a doctor, it's a nurse, it's an assistant nurse. They have other areas where they know a lot about, but probably not about translation and communication across languages. So some of the users might use the tools and just communicate the way they would speak in their own language. And maybe they use slang, or they use really long sentences. And all of these things would make the translation worse, probably. So we're trying also to educate a bit. It's not only the tool that needs to perform the best, it's also the user knowing how to use the tool in a better way. And we're trying to tackle that.
That's a great thing, I think, for designers as a whole to keep in mind nowadays as we start working on AI tools, because it is still a field that a lot of people are not very familiar with. A lot of people might be using ChatGPT, but they don't. I mean, there's been so many stories about people having a misunderstanding of the accuracy that ChatGPT can provide. And so I think it's such a good thing for designers to think about, how can I integrate that kind of education for users while they're using the tool. So I love that. And the last thing that I'll touch on before I hand off to Bella again is, as far as regulations at an industry or governmental level, is there anything that has been set out that these tools need to align to in order to be able to be used in these medical contexts?
Yeah. Like the biggest one is patient and personal data protection, or how you handle that data. So you really need to either make sure you don't save any of that data, or if you do and handle them, to be able to describe how you protect the data if someone would access your tool or your data set somehow. They should not be able to, get the information of a patient and the medical history of the patient. So those are regulations that are really strict, and you need to comply to be able to be a contender for a healthcare provider wanting to purchase your solution. I think that is the most important one currently. So it's connected to like GDPR and HIPAA compliance and those things.
Great. And I just want to check with Ola. I feel like we've answered that question for in this section about, basically that we find it really refreshing that the Care to Translate is very open and honest when separating AI appropriate applications and the ones where they're not. And because there's definitely, we're in a time right now where everyone's kind of slapping some AI onto their tool, and maybe not thinking through the effects of that. But I think in this tool, it's a really good example of not putting AI on a pedestal necessarily, and just being really honest about, look, you can use this. Here's where it's appropriate, or here's where it's not. And if you proceed like this might result in some consequences. Then again, maybe it's also very, you immediately see the consequence of like a misunderstanding in this high stakes context. So
yeah, but and that's one side of it. The other side is that the healthcare industry and care industry has been using Google Translate for the past decade or two, because there is nothing else. So they need to overcome the language barriers. Interpreters are scarce, or not available for everyone. So they try to, get a hold of the tools that are accessible for them. One or several of them already being mentioned, such as colleagues, children, or other relatives. But Google Translate and other open tools, not only Google Translate, has been one of those as well. and everyone knows it, and all the staff members using them also report to us. We have been using it. Sometimes it's the translations are really wrong. We feel it's hard to rely on it, and healthcare providers are becoming more and more aware of that. That is a tool being used. And these tools, the free and open available tools, are not, for example, HIPAA compliant. They don't protect the data. So everything you would type into or speak into, those applications are actually stored on the provider's servers, and the data is being trained on these conversations, which is completely against the rules of personal and patient data compliance. So there have been like those two voices becoming louder and louder. One is the data protection voice that says, oh, we should really review what tools we're using. And the other voice is, we need instant translation, but we want to have higher quality of these translations. So that's also part of why we communicate the way we do. We want to make them aware that there is a difference between the free available tools and tools that have been customized to fit healthcare provider needs better.
Mm-hmm. Yeah, I think that's also a really important lesson to apply to any new technology. It doesn't have to be to AI specifically, but for designers working with novel technology and introducing that into especially a health tech context, that not pretending that this is perfect and this is going to solve everything. And so yeah, I think that's a really important thing to take away with us. I wanted to read this quote from your site, and it's from a staff member at an intensive care unit, and it says, "The patient was sedated when we woke him up, and he was naturally terrified. He didn't know what had happened to him. He had tubes in his throat, and he could barely move. Then we used the app to explain to him in his language that he was in the hospital and that he had been in an accident." Wow, my reading is in situations like that, this is a really good tool to have. It really helped to calm him down. And that's a beautiful situation that you can that this tool can help in. Can you tell us a bit about how the app is designed to allow doctors to even more quickly reassure a patient when it's really urgent?
Yeah. So we design, or you can customize the app for your specific needs, with the thought of every department being a bit different. So this would be like the post-op or intensive care department, where you have a specific patient journey and need for specific communications. So in that case, the users can set up a playlist for the situation when the patients wake up. That's also something that I didn't think about before joining the team. Is, of course, every time you've had surgery, you will at some point wake up, but when you wake up, that's not always really easy to know. It can, be earlier or later than planned. So you will not have the interpreter there waiting for like 2 hours for a patient to wake up. Typically, patients wake up when they wake up and there's no one. Of course, the nurses that take care of the department and the ward. So for those situations, this is also a really good tool to just like, okay, we can see a patient is waking up. Be prepared with your tablet or your phone and have the easy access to that specific playlist where you can give the information. Also in the intensive care, we've heard like sometimes they have a hard time breathing because they have those tubes in their throat. So they can also give instructions really fast when they can see that the patients feel uncomfortable or maybe are starting to panic, because it can be really tough to breathe and they might feel like they're not getting enough air. So different situations like this can, you can have the prepared playlist, and it helps instantly. And of course, then you can use the live translation feature too. But that actually takes twice the time compared to the playlist. The playlist is ready, you have the sentences, you just click on the phrase, you don't have to speak into it and wait for it to translate. You just like click and it basically translates instantly. So it's a time saver as well.
When I was playing around with the app, the Care Recipient version, it definitely jumped out at me how simple, straightforward, and very minimalist the design is. And I know that's one of the things that was referenced with the most recent Red Dot Design Award, which you guys won, which congratulations,
Thanks.
side note. Very well deserved. And I saw that your product designer mentioned that one of the biggest challenges has been designing a user experience and interface that works equally well for people from completely different backgrounds, speaking completely different languages, and using it, to your point, in completely different contexts. And so to kind of take a step back and ask this at a broader level, what is your design approach when it comes to this kind of challenge and, accommodating these different contexts?
I think somewhat flexibility to be able to customize maybe if it's needed. That's one of our ideas behind designing, but also trying to keep it as simple as possible, and maybe alternating or changing designs when we get feedback from users. So I mean, in the end, it's a tool that needs to be accessed quickly and in emergency situations. So even though we love beautiful designs, it needs to be really still easy to understand where to navigate and what to access. So it needs to be very clean and clear. So that is something we try to follow all the time. And what makes it tricky for us sometimes is that not only will you maybe have different ideas about symbols or colors, the text itself can be different. In some countries, you write from right to left, and others from left to right. Some symbols might be bigger or smaller. And that is something we try to navigate while keeping, the frame of the app as simple as possible. Yeah, and I actually talked with my designers about this topic, and one of them, he said that it's kind of like trying to give the right temperature in a room, where you want to have it medium somehow, but for some users it might feel too hot, that for some it might feel too cold. So trying to level it at all times in regards to the users that we have today, and really listen to them and see, like, is the temperature right for them. So that is how they try to navigate. And yeah, we have really close contact with our users and customers, and try to have the ear towards them at all times. And even if we think some things are so easy to understand and comprehend, or some things look better than others, if we get the feedback from our customers and users that they don't agree, or they have difficulty finding things or navigating, that is something we need to listen to. Because again, our users are not usually, at least, educated to appreciate great design. They are educated to help patients, and they want to do it fast, and they don't, I think they don't even want to feel like they're using a tool. They just want it to work somehow. So trying to make it as simple as if it wasn't even there, which we are not really at the stage yet, but kind of like, yeah, it shouldn't be a barrier to use a tool. It should be like an enabler for you to communicate.
100%.
It's
like it's really hard, but I mean, you can tell from the design that you have a design team that listens to its users and takes that feedback. Because to your point, I think some of the best UX is the UX that you don't even notice because it's so flawless and so smooth in how you use it. And your emphasis on simplicity reminds me of a conversation that Bella and I were having, I think, an episode or two ago, where we were discussing this Figma talk that was given by a designer who is part of, I believe the app is called Forerunner, but I will double check. But essentially, it's an app for climate emergency response teams. And this is exactly the same thing that she was saying, where it's like, at the end of the day, form very much follows function when you have these situations where the stakes are very high and you have to think about, like, what if power cuts out? What if there's no connection? What if you're in a situation where the patient wakes up sooner than you expected? And so I think I have a big appreciation for products that do, at the end of the day, think about, what's the functionality first, and then yes, great design can follow, of course, but at the end of the day, the most important thing is that it addresses the needs of your unique user group. And then, speaking of kind of unique users, your app is kind of touted for its accessibility as well. And so I was curious, what activities, practices, or tools do you guys and your team use to make sure that the app caters to users with these various physical or cognitive disabilities?
I mean, there are some accessibility guidelines that we follow. One of them, I don't know if it's the same in all countries, but in Sweden we call it WCAC, and there's several versions, and we try to follow the most recent version. There are also some guidelines from like big customers, municipalities, and regions, where when they buy tools for their employees, these tools need to follow some of these guidelines or rules. So that's something we try to incorporate in the product, and that can be such as being able to enhance the size of the text, or being able to have the audio playback faster or slower. Contrast, we work a lot with contrast. Being able to navigate the application with your voice, for example. So we try to incorporate that as well, and we can see that there has been an increasing focus on these types of topics from the customer sides as well, which we think is good, because it's also, again, about inclusion and being able to use digital tools no matter who you are. And probably our tool cannot be used by everybody, but we try to make it usable for most people, at least.
Yeah, that kind of stuff is always, I mean, I think just also the part we were talking about in the beginning, just making medical jargon really, like, having the focus on making that really easy to understand in and of itself is a big accessibility point in this context.
Yeah.
And as we now start to onboard a lot of elderly care organizations, sound, being able to hear sound maybe at a slower pace, being able to read larger text, or even being able to look at images, that is also part of increasing accessibility for the users. So yeah, it helps us a lot to understand the use cases, who is navigating the product, but also who is the recipient and what needs do they have. And hopefully, for one part that we do not provide today is, for example, sign language. And sometimes you might not think about translation as in sign language, but sign language is also a big part of the languages where usually interpreters or sign language interpreters are used. And it's not as easy as you might think, because there is not one sign language. Every language has their own sign language. So that would be an area for us we have not explored, but maybe in the future could be added. And here again, AI in these fields are starting to explore how can you work with AI to translate sign language. That's really exciting to see. And once the development here progresses, maybe that is something we can also incorporate in our product.
You covered this a little bit before, but I just want to go back and see if there's anything else in terms of guiding principles or practices that your designers use. Like, do they have any rituals that they go through to really make sure that all of the goals are being met, or that the vision is being upheld? Do you have anything to share there?
Yeah, and I have a cheat sheet from my designers, and again, they would be much better in telling you. But like the visual and structural principles that they follow are, as I mentioned, also good contrast, scalable typography, multiple visual cues, colors, icons, text, instead of relying on just one. Consistency, and for example patterns, to reduce also learning efforts. Clarity over complexity, so using progressive disclosure to reduce cognitive overload. Inclusive mindset, and I mean inclusivity means a lot of different people we need to consider, but considering different cognitive and situational needs. So, for example, live translation split views versus regular view. And then also close collaboration across roles with the linguists as well, to ensure that phrasing and app texts are clear in all the supported languages, because the product is localized to almost 50 languages. And, you know, it's not only the phrases that are used in the healthcare sector, is also app text and things like that matter. So that is some of the information I got from my designers.
That's a great cheat sheet. I love that. All of us should have cheat sheets.
I know, I'm taking that idea. I like that.
Yeah. Oh, and it's stuff that is very universal for no matter what you're designing. I think if more designers applied this to whatever product they're using, again, in healthcare, you're really forced to think of the most vulnerable situations and groups on a different level, I think, than maybe other sectors or other industries. And I think if we applied that to any industry, we would have a more accessible world with more accessible tools at our disposal.
And I think also being used in so many markets and countries, and having the difficulty with translating appropriate, even the app text has also forced us to really think twice before adding an app text, trying to use symbols and buttons that are understood as well instead of texts. That is something we try to enforce more than just adding a new text and a new feature, trying to, while adding something, maybe even reduce something, combine it with something else. And it's also connected to maybe the size of our team. We are not yet the biggest company, and we don't have the possibility to work in all the markets with all the customers and educating them about our product. So instead, we try to make the product as easy to understand, to reduce the need for education and onboarding, which is really, really, really working. But that, again, is something we think a lot about when also designing the product. Is we don't want to add a new how to video or have an onboarding. We would like them to understand by themselves.
Tell us a bit more about your relationship with the designers on your team. How are you involved in, or are they involved in what you do? Like the back and forth of that. How do you collaborate with each other?
I think it goes for all teams. We have really integrated processes, you could say. So we have different teams. We have our designers, we have the linguists, we have the developers, we have marketing and sales. But then we have cross-functional teams that source people from all of these teams and have their meetings or processes where they sync different initiatives. And that goes from planning the strategy, the product strategy for the next year or so. It involves all of us. Or talking about the content of the product, being content as in new phrases being added to the library, but also new information being available in the application for the users. So we usually try to collaborate from all teams when discussing these topics. But then, of course, the designers are the experts in the design. So we're not talking about the solution together. We're talking more about the need. What problem are we trying to solve? And then the designers, of course, will have the possibility to design, and then we try to test it. Sometimes we do testings just internally. Sometimes we have like a bigger scale testing with customers. Sometimes the testing is rolling it out and seeing if we feel really confident, just seeing what the feedback will be. So there are different types of testings where then, of course, the designers will get feedback on the solution. So trying to collaborate before something is developed, but then letting the professionals do the work. And then receiving feedback afterwards.
And I'm sure based off that feedback, the app has gone through a lot of iterations over the years.
Yes.
Because I know you guys originally launched in 2018. And Bella and I, when we were talking about kind of previous work that we had done in health tech, there was a big gap in the initial launch versus how it looked like now. So we were curious, what did those earlier versions look like, and how has that changed?
So when I joined, the first version of the app was already on the market and was spreading virally, and that got me hooked, and of course the team. But having a design background myself, so I'm an architect and industrial designer, I was the first person on the team with that type of background, and I thought the app was so ugly. I told them so they know. For me, it was kind of like a calculator again. It did the work, but it just looked like a calculator. It was not so nice. And I wanted us to design a product that, also felt like a modern product and would spark, engagement and make it fun using it. So yeah, it has changed a lot, but that's also thanks to us being able to onboard some really good designers and iterating, of course, several times. But yeah, in the beginning, it was not so beautiful, but it worked, and that itself made it spread. I think when I joined about 6 months after the launch, it had already 20,000 users. And I thought that was, and without any marketing being done, it was just mouth to mouth communication. And I was impressed by that. And that also shows that, maybe sometimes it's better to get something out and then also be able to refine. We back then didn't really know exactly what the product will look like today. So many features have been added. Some have been added because we believe that's the future. Some have been added because big customers have requested them. And that's also interesting to take into consideration when designing something. Sometimes you build a product and a feature that you yourself believe in, and you're just really excited to do it. And sometimes you kind of have to add something because this really big customer will only select you if you have this thing that they need or so, and you maybe don't think they need it, but still, you want to win them over. So there has, of course, been times when we have been working on something that, at first when we've added it, it has just been another button, and it didn't really make sense to us in a way of how does that fit the vision of the product. And then as it evolves, we can see, okay, this works, but we want to have it in a different way. And then we can design it into our, product roadmap. But sometimes it's good to get something out there and refine. And sometimes you have time to think it all over and make it beautiful when you launch.
Yeah. No, that's a good that's good to keep in mind. I think that at the end of the day, you can't let perfect be the enemy of good enough. Obviously, there's regulations that you align to and all that. I mean, we're not like, move fast and break things level, but I think there is something definitely to like, at the end of the day, it doesn't all have to be 100% perfect in order to have something that works well. And as far as the process of launching the app, what was it like kind of making sure that was compliant with the Swedish, and I know you guys are in Norway as well, Norwegian health regulations, and the process for kind of clinical trials as you guys scaled?
In the beginning, when it still was the calculator, we didn't process that type of information. So it was really easy for us in the beginning to, be able to spread and grow our market. And it's actually with the AI translation feature that all these complications have been added to our product. But while working on that feature, we knew that would bring complexity, and that made us, I would say, aware of what we need to provide and to show. So it kind of went hand in hand with the development. But I think definitely in the beginning, it was really good for us not to have all these restrictions. I mean, still we had to comply, but we could just show we're not, you don't even enter any information into the application, so there is no information going around at any time. That helped us a lot to just, being able to move forward and to grow. Also, we are not a medical device because we don't provide information on how to treat patients. We are simply a communication product with a focus on healthcare communication. But, and that was also a question in the beginning. Should we be a medical device, or do we need to provide that, certification? And going back to then, I'm really happy we found out we didn't need to follow that process, because all of these processes, of course, make you need to put more time into certain processes and documentations. You can't just launch a new version whenever you have to, follow certain rules. So, what I want to say, working in the healthcare sector can be really good to have a product that does not need to fulfill a lot of these things in the beginning, because that will help you, be able to prove yourself. And once you have the knowledge and maybe a bit more financial muscles and the team to scale, you can add those layers. But of course, for some solutions and product services, there is not the choice to go this or that way. But for us, there was, and we have since then tried to stay in the clear from not needing to become a medical device.
Yeah, as somebody who just went through the whole MDR process, but we're on the other side now, and it feels so good. But that must have been really nice to not have to be a medical device. And for those listening from outside of Europe, every medical device just had to go through the past couple of years had to go through recertification through a certificate called MDR, which is basically our FDA approval, and all medical devices had to go through that. So that must have been such good news for you and the team.
Yes.
Just on being the CEO and running a medical startup, can you tell us what that's like? What was it? What you thought it would be when you first got into that role?
I mean, I was not the CEO at first. So I think I got used to being in the startup world, building a medical product or a solution for the healthcare sector before I needed to decide if I wanted to be the CEO or not. But I think, to be honest, I never thought about how it would be. I'm a person who can engage quite quickly when I think something is really good or cool or I believe in it. So how I joined the team was that I was introduced by there's a startup accelerator in Stockholm, which I knew quite well because I had started and built a different company earlier and gone through that accelerator. And for a couple of years, I had been working as a freelance consultant, you could say, for tech companies, small and big. And I was looking for, to join a team again, to build a product and a team and a company. I really longed for that. So I reached out to this accelerator and their coaches and asked if they had any, startups that would need someone like me. And for me, it was really important that it was a impact company. I hadn't worked with impact companies before. And I thought that, I usually spend a lot of time when I'm engaged in a project, and all these hours, all these days, I want to do something really meaningful. So that was kind of the rule for me and for these coaches. And I met with a couple of companies, I think at least 20. And, there's always something. It's either the team, maybe, that you feel like, I'm not sure it's a good fit, or the product, whatever. But when I met Linus, and he's just a really wonderful person and really inspiring. And he showed me the product. And yeah, it was just... I saw the need for the product. It had already started spreading virally, so there was just also a sign of it being something that could actually grow. And I could see that they had the need for someone like me because there were 3 doctors working on this application. And for me, the thought was more, can I help growing this company and growing the market for the product? It was not so much the thought entering that specific industry or leading the company. It was just like, let's see how I can help them make it better, bigger, and make it become a stable company. So that was quite naive, I would say, thinking back, because it is, I mean, building a company it's not easy. You need to always be kind of positive and thinking that, you know, you can make it even better, and it will, you know, grow into something even more beautiful. So you always have to have that kind of positive vision. There are a lot of setbacks, so it's kind of like the roller coaster everybody talks about, and you need to be able to brush off those lows really fast. And the healthcare sector, I mean, it's a slow big thing. Really need for you know, a big change when it comes to implementing technical solutions faster at scale, but they're not really there. And it's all these regulations, it's the budget, it's other priorities. So sometimes it's hard to get through. But we are at the point now where we luckily have a lot of nice customers, big names in the healthcare sector. We have customers in 12 countries or 13 countries today. And that makes it also easier to approach the next company in that market. Because even though we had customers like the Karolinska University Hospital in Sweden, which is like the #1 hospital in Sweden, when we went to Germany or the UK or the US, that might be a known hospital, but still they were asking for a reference in their own country. But now that we actually are gaining traction, every new customer in the same market becomes easier to, you know, approach. So yeah, if listeners are working in this market, I think you're not really at the level where it just, you know, has started to sell itself. Hang in there. Because the healthcare sector really needs those new and beautiful products. I don't know if you have seen the systems where they log the patient journals. Like, you can't really believe it's this century. You think it's like from when the internet was born and the computer was born. Linus, who now is back to working as a doctor, he actually messaged me, I think yesterday or this morning. He said, news from the healthcare, from hospital life. Yesterday I had to fax something.
Oh my God.
And today I got my schedule mailed as a letter, like a physical letter.
Wow.
So I think, you know, all these doctors, these nurses, and the patients, of course, but they need better tools and more beautiful tools. So I think all of us who are in the sector, we know it's not a fast-moving industry, but it's an industry with huge potential.
Yeah, I think that's something that Bella and I always go back to with like why we have such a passion for health tech. And to your point, I think for anyone that's outside the space, they might think it's a little bit bogged down with regulation, and you know there are constraints, but there's so much opportunity.
Yeah.
And it is sometimes a little scary, the decade that doctors are still operating in. But yeah, I love just hearing about your whole journey and your experiences. And I'm very impressed that you didn't think about what it would be like to be CEO, because I'm like, I can't relate. I would be overthinking everything. We did have one question also that we want to touch on as far as the cost saving benefits, but we did talk about that a little bit beforehand. But I'll just mention that we did see the cost saving tool, like the calculator on the website. And I forgot to kind of bring it up earlier when we were talking about it, but I really liked that, and being able to kind of directly see the impacts, like Bella was saying, kind of the quantitative KPIs right there in front of you with the hours saved and the money that you can save with the tool.
Thank you.
But of course, Bella, do you want to take the last question?
We wanted to know what your favorite word is that you've learned from a different language since you started working with this tool.
Um, well, there's one word that comes into mind, and I don't know why it's a favorite, but uh, it's a word that's been used a lot in when you do radiology exams, and it's contrast fluid. And it's a fluid that is injected to you during certain radiology exams to make, things more visible. And why that comes into mind is before starting working at Care to Translate, I had never encountered the word contrast fluid. And it's actually a fluid that you can be severely allergic to. So it's a really important question in the healthcare sector. And sometimes you might not understand what it means. So we have, of course, also sentences to explain it, because if you're undergoing a radiology exam and they need to give you contrast fluid and you're allergic to it, it can lead to, you being not able to breathe, and it can be very harmful. So it could even be fatal. It just shows me that there's so many words you don't know, or things that, can have a severe impact on a person's life. So it's one of the words where I was like, interesting. I didn't even know it existed, but it's a really important thing to know about. Yeah, that would be my answer.
Yeah, that's a good one. You had a great story for it too.
Yeah.
It's not a word that I think I've ever had to even say either. And yeah.
And also that's good to know. I'm like,
Yeah.
I will
Yeah, I
I
didn't know
will
that
be looking out for that question if I'm ever going into any sort of radiology situation. But it also just like made me think of like, to your point, when you undergo any sort of like longer hospital stay, or a situation that you haven't been through before medically, to your point, there's so much that you learn that you're like, I didn't even know, like, this is something that we had a word for, or this is something that you had to be mindful of.
And also maybe wrapping up why we do this. So in the cases where you get into the emergency clinic, maybe rushed with an ambulance, and they need to do a scan, and they would need to ask this question. But in many cases, they're not able to get a hold of a human interpreter via the phone. So they need to save the person's life, and therefore they just do it. And they kind of hope that the person is not allergic, because they will not be able to ask the question. And having the application, you have a quick button to just simply ask it really fast. And it's such an easy solution, but it can actually save lives. And that's why I think everyone should, be more mindful about the communication and translation supports that exist, and why it actually can matter to have something that is validated and easy to access at any time.
Excellent.
Amazing. What a nice little bow at the end to wrap it all up.
Yeah.
No, that was, I mean, it was so incredible to listen to, the thinking behind the tool. And there's to your point, it's a simple solution, but there's so much to it, and it addresses this huge problem. And at the end of the day, like that's the most important thing. And the simpler the solution, the better. So yeah, thank you again also for staying longer and answering all our questions.
Yeah.
No, I
Yeah.
think like my heart beats for design as well. So I'm really happy to be speaking with you today, and to be able to share a bit more about Care to Translate and our journey.
So Bella, what were your thoughts on the conversation with Maja?
It was so nice to speak with someone who has that role in a company, and then also has a design background, first of all, that like someone who speaks the design language as well was really interesting. And also just what we talked about in the actual conversation with Maja, that just being like more to kind of slow down and be really, really intentional with everything you put into your designs and then ultimately into the hands of whoever uses the tool in their life, especially when it's like emergency situations and panic and things like that. I think we all, like I said, have a lot to learn from that. If we can apply it to other sectors or other industries, I think we'd have a more accessible world.
100%. And I love like that she kind of emphasized again that point that's been coming up I think a few times for us about functionality first.
Mm.
And I think when flashy designs tend to get more hype and more noticed and they tend to win awards, ironically their app did win an award, but
Yeah.
it's refreshing to see a solution that you can tell at the end of the day is focused just on how do we help our users get from point A to point B in the smoothest possible way. And that doesn't mean that you can't also have great design. I do think the design of the app is excellent too, but it's just nice to see it. I think you can see this kind of principle throughout everything that they do, from like the emphasis that they put on making sure that the phrase library is this gold standard that is always reliable, easy to use, and then also with the live translate, to your point, it's not just about slapping AI on a solution and saying it works. It's being very conscientious about when it's being used and why. So I really appreciate that. Plus, obviously, the conversation we had around the cultural impact. I mean, that's the qualitative part of it. That, like, when you hear about stories like the patients giving their caregivers a hug because they're so excited about the fact that like there's someone who's actually speaking their language and it works and it's not just Google Translate, right? It makes sense. It's like, yes, that's not the hard and fast like financial benefits, but at the end of the day, as designers, and I think anyone who's running a company that, as Maya mentioned, is an impact company, that's the kind of stuff that makes it feel like this is so worth it, you know?
Definitely. Yeah, that hug, that like that the impact of that on somebody who like waited maybe longer to actually seek that care and was feeling maybe apprehensive about not being able to communicate effectively with their provider, and then that resulting in a hug because you're just like, yeah, that you can't put a price on that almost, even though the tech world wants to put a price on on everything. But no, that was really nice to hear that there's so much that goes into both just like you said, the cultural aspect of it, and also the point about not only like adding in AI as something that enhances your design and your tool, but also teaching people how to use the AI. I was like, yes,
that was such a good point.
Yeah. I love that because I think we're all in tech, right? So then we kind of it's hard, like no matter how much you tell yourself that like, okay, we're not our users, the tech landscape are the people that are adopting AI the earliest and are using it probably all the time, and in everything, not only just, I mean, like in work tools specifically, but also like just chatbots and things like that. But there's a lot of people out there who have no experience with that before, don't know like if they can trust it, if it all of that, like how to use it to its full potential is so important. if you're going to stick some AI into your designs, your products.
100%. And the other piece of that she mentioned within the same kind of topic was noting to or alerting the user when they're talking about a sensitive topic that they might need to double check that the patient fully understands. I was like, that's genius.
Yeah,
Like that feels like you're really using the capabilities of AI to go past what a traditional translation tool would do, where it's not aware of the context. It's not aware of what the severity and seriousness of some of the topics that you're discussing, and with the abortion example, and just flagging that word immediately and being like, this is very sensitive. I like that example that she gave of, it's not necessarily education on the tool, but it's just a moment to humanize it and be like, hey, be mindful here, rather than just kind of assuming that the doctor's going to know,
Yeah,
So
definitely. Yeah, a great example of being aware of what's happening around the people using your tool. Yeah, I love that. And also, like you said, the X-ray, what was it? Contrast fluid?
Contrast
I didn't know
fluid,
that you could be deeply allergic to it.
yeah, it's scary that because of like it's all the cases she brought up where people don't seek care or they take risks with people's health because of these language barriers. It just goes to show how important this tool is. And it's crazy because it is something that's such a simple solution, and yet it addresses literally life or death challenges that are being faced in these different contexts. And like with the contrast fluid and being in the ambulance and not being able to ask the person if they're allergic, and so you just, which by the way, I don't know if I'm allergic to contrast fluid, so even if they ask me, I can tell them. But,
how would you know?
I don't know, but but if they do know, like being able to ask them as opposed to just guessing and hoping for the best.
Yeah, you're able to give your consent then, like, yeah, I don't know if I'm allergic to it, like, let's try it, rather than just being like, hey, you're sick and you're really vulnerable and probably really scared right now. We're in an ambulance, but I need to give you this, and like, you don't know what's going on. Like,
we'll see what happens.
Yeah.
So yeah, no, I mean, I think it was a really, really good conversation, and I loved just the mission behind the tool, and I love the way Maya went through it. So yeah, and it was cool to hear her experiences as a CEO, too, especially of like a health tech startup that is still growing. And like she said, I think she brought up a good point. As a CEO, you do have to keep a positive mindset, because you do kind of set the morale for the team in a lot of ways, which is a responsibility that I think you are kind of free from as a just regular kind of team member. But as a CEO, like even when you have those setbacks, you have to still believe that it's going to work.
In the mission, yeah, the vision.
Yeah,
definitely.
If not for yourself, which obviously for yourself as well, but also for the team. So it's a lot of responsibility.
Yeah.
But yeah, cool. All right, should we wrap officially?
I think we did it.